I'm ready.
Give me 2 seconds, sir. I'm kind of focusing on
You ready?
Kurt, give me 2 seconds.
Well, 2 seconds has come and gone. These millennials need to have to figure out what seconds are. Just trying to help you out, Dave.
Hey, baby. We're live up on this because
All good? All right. Good afternoon and welcome to Seminole County Government 11/10, November 10th press conference. We are glad to see all the media here to help us get out the message today. Got a lot of things we want to talk about. We're also going to have Ms. Donna Walsh from the Florida Department of Health here to speak as well related to the pandemic, the COVID numbers and some things that are happening there, as well as we're going to have our Emergency Management Director, Mr. Alan Harris, who's going to talk about some closures tomorrow and anything and everything related to emergency management. First, I want to take the opportunity to thank our community who continue to be vigilant and watching and trying to do all the right things during the COVID pandemic. Unfortunately, we're starting to see, like many parts of the country, numbers starting to tick up in the wrong direction. We want to remind everybody that our mask ordinance remains in effect, and you should be wearing a mask anytime that you cannot socially distance 6 feet apart from other people. If you're outside and you can stay 6 feet apart and you're outside outdoors enjoying the great outdoors, we want you to do that. But if you're in close proximity to other people, you need to be wearing a mask. Again, we want to thank our business people, our business leaders who have obviously tried to make sure that they're doing the right things for themselves as well as the patrons. As you've heard me say on numerous occasions for the last 6 or 7 months, the business people know if you're not making the public feel safe, they're not going to come do business with you. We need to make sure that our community feels safe as well as remain safe. So our experts in those areas are going to talk a little bit about those items here in just a few minutes, but I want to thank the business people as well as the community who continue doing the right thing in an attempt to stop the spread and mitigate the virus moving through the community. I want to give you a Seminole Cares update. This Friday, November 13th, the Seminole Cares Small Business Grant Application portal will close. To date, Phase 1 and 2 of those CARES programs, we've approved funding in the amount of $11.7 million to 1,500 small businesses. So we've managed to put out $11.7 million to those 1,500 Seminole County small businesses. This is something that we're very proud of finally getting out. There was some speed bumps, some hiccups along the way. Obviously, we'd never been tasked with doing such. I know we've received a lot of calls of people having issues, and we've tried to get them to work through that as much as possible. On average, most businesses that were approved, those applicants received over $7,100 in assistance on the business assistance front. In addition, the county has approved over 4,200 applicants for individual assistance in the amount of $17.1 million between Phase 1 and Phase 2. On average, approved individuals received almost $4,100 per household. It was very important to this Board of County Commissioners that this money be utilized to help our community, and these are the two areas that we've seen the most need, the small business and the individual cares areas. As people continued to lose their jobs, as businesses were impacted, we feel that we've done a pretty good job thus far, and the monies that were allocated to us through the CARES Act, both federally and through the state, that we've been able to get these monies out, and it will continue to go out accordingly as we work through those applications. Originally, the county earmarked $10 million for small business and $7 million for individual citizens. However, seeing upon a greater need, we allocated those additional funds to those programs, and that's where those additional numbers come from, the higher numbers. The county has increased the funding assistance amounts to $14 million for small businesses and $19 million for individuals. So we continue to understand there is a need there, that need continues, and we have funded accordingly. In addition, $2.9 million has been awarded to 44 nonprofits delivering essential services to our community. These are the nonprofits that are doing service on behalf of the community, providing food, providing a place to stay, accommodations for short term, reaching out to the public who have other needs. We've done this to help them because they're doing the work that otherwise we would have to try to find somebody in the county to do, and we just not our staff to do that. So we thank our nonprofits for partnering with us to do what's necessary for our community. It's another reason why Seminole County is such a great place to live. You know, we have these nonprofits that are helping those in the community. Our funding is also tied to Census. You've heard me talk about the Census. Seminole County has averaged more than $31 million a year in federal and state grant funding over the past 3 years. With the county receiving nearly $43 million in fiscal year 2019, according to the Budget Office, the majority of these grants were tied to our census data. At the close of the self-response period, Seminole County remained number one among Florida counties for resident response to the 2020 census. Again, Seminole County number one in the census, with a rate of 73.6%. This figure also charts above the national average for self-response, which was 67%. So we're above the national, and we've beat out every county in the state of Florida. The U.S. Census Bureau estimates that $2,000 was allocated for every person counted during the 2010 census. Over the following 10 years, this trend holds for the 2020 census. Seminole County residents' responses could equate to over $944 million in funding by fiscal year 2030. That's why the census is so important. Again, we want to remind you that our COVID mask order remains in effect. Seminole County's social distancing and mask order remains in effect despite rumors. There's been a lot of rumors that, oh, you don't have to wear a mask, we shouldn't do this, you don't have to do that. That's been repealed. That has not been repealed. When in place of assembly, business, or other places open to the public in Seminole County, individuals should maintain social distancing. Members of the same household do not have to keep 6 feet apart. Obvious reasons: you're living in the same house, you're sharing, the same air, you're sleeping in the same place. We've had a lot of those questions, so I want to make sure if you're in the same family, you don't have to stay 6 feet apart away from your child. If individuals are within 6 feet distance of one another, masks should be worn by all parties. Inside private businesses, if a customer is non-compliant, the business has the right to refuse service as a private business. They have the right, just like requiring you to wear shoes, shirts, they can require you to wear a mask. They also, if they have problem with compliance, they can and we should request them to contact law enforcement if they have an unruly customer or client. Masks are required by all patrons and employees while in county facilities. In other words, all facilities here at the county require masks to be donned and worn at all times. If a visitor does not have a mask, we're happy to provide one for you. As a reminder, to date, Seminole County and its 7 cities have not issued any fines or penalties for anyone not wearing a mask. It's driven for education. And again, I can't thank the public enough for doing the right thing to help mitigate this. There's a lot of, we all see a lot of social media, a lot of rumors, a lot of statements. Look, folks, this is not a Republican, a Democrat deal. This is a virus. It doesn't care who you are. It doesn't care if you're a Martian. The reality is you need to be smart, pay attention. We all know what's right. We've all been hearing it for 9 months now. Literally, wash your hands, don't touch your face, wear a mask when you're in close proximity to other people. It really is simple. And doing this simple thing is going to allow our economy to continue to thrive. As a result, Seminole County still remains one of the lowest unemployment rates in the Central Florida region. I credit that to our businesses as well as our community, who are doing, for the most part, the right thing so we can get through this. You're going to hear a little bit more data, I think, about vaccine. We've had a lot of questions, people inquiring when the vaccine is going to come, what's going to happen. Alan Harris is going to hopefully talk a little bit about some of the steps that your county commission has done and funded in anticipation of the vaccine, so that Seminole County is going to be on the front line, ready to roll these out when it becomes available. I commend Mr. Harris in doing so and bringing that to the attention of us here at the county, so we could be ready to go when that vaccine is ready. So with that said, I'm going to turn it over to Donna Walsh. here with the Florida Department of Health. Donna, welcome and thank you for being here today.
Thank you so much, Chairman Zimbauer, and good afternoon, everyone. As Commissioner mentioned, the county as well as the state and many states in the nation have seen a steady increase over the last several weeks in the number of reports of COVID-positive cases. In the state of Florida, as of last evening, there's been a total of 847,821 positive cases reported, with 17,179 deaths. Here in Seminole County, we've had a little over 11,000 cases reported now, and 253 deaths. To put that into perspective as far as our vulnerable populations, I know we've been speaking of this since the beginning of this response, but our vulnerable populations still are those with underlying health conditions, and more so our elderly or aging population. Of the total number of cases that we've had, 10.5% of those cases have been associated with people in long-term care facilities, whether it be employees or the residents themselves. And out of the 253 deaths that we've had reported, 64% of those deaths, 156, have been associated with long-term care facilities. So we need to remain vigilant to protect our most vulnerable in the community. We've had a total of 771 hospitalizations during this response. Currently, we have 56 hospitalizations, and that has steadily increased over the last several weeks as well. We were hovering between 20 and 30 hospitalizations for several weeks, and we're gradually increasing. We do continue to have weekly calls with our hospital systems, and certainly our hospital systems are well equipped and prepared to respond to the slight increase that they're seeing in hospitalizations. There doesn't seem to be a concern as of yet. What they are finding, and what I would certainly share with you, is if you do have any other illnesses unrelated to COVID-19, please don't hesitate to go to the hospital if you need medical care. They are concerned about those people in our community who are waiting till they're critically ill to go. And so please, if you do need medical attention, don't hesitate. Hospitals are very safe. They are taking precautions above and beyond. And so just want to reassure our community. The other is that we have seen an increase in the positivity rate. The daily positivity rate as of yesterday was 9.57%. We have seen that increase as well. You may recall the last time we had a press conference, we were certainly under 4% positivity rate. If you look at our last week, November 2nd through 8th, we had a weekly positivity rate of 7.03%, and the prior week 6.14%, with a 2-week average of 6.58%. And so if you also look at our daily reports of cases, the last weekly report, I should say, November 2nd through the 8th, we had a total of 476 cases reported. If you compare that with a month ago, October 12th through the 18th, we had 280 cases reported for that week. So we've had almost a 200 case increase within the last month. The previous week, October 26th through November 1st, we had 417 cases reported, and October 19th through the 25th, 343. So going backwards, you can certainly see a steady increase in the number of cases. This does not compare to the peak that we saw in July, where we saw a really sharp increase in the number of cases. And that's why it is so very important that we continue the non-pharmaceutical interventions, the facial coverings, as Commissioner mentioned, as well as that social distancing, more than 6 feet apart, and the appropriate hand hygiene and other hygiene practices. That's really and truly, folks, our only defense right now. We do see that this is working across the nation in minimizing the spread of this virus. It's very, very infectious. If one thing we've learned over the last several months, we know that this is a very infectious virus. There are some people who are asymptomatic. There are some people mildly symptomatic. But then there's those who become critically ill and unfortunately some who die. So we're trying to protect as we've mentioned before, our families, our neighbors, our friends from contracting this virus and from spreading it, and thus also allowing us to keep our businesses open by these practices to protect those around us. So as far as the congregate settings, we're working very closely. As I mentioned, we have weekly calls with our hospitals partners. We also have weekly calls with our nursing home long-term care facilities, along with the medical director, Dr. Todd Husty, and the emergency manager, Alan Harris, and his team, to address any unmet needs, whether it be personal protective equipment, new guidelines that are coming out, testing, and so forth. The requirement for facilities, nursing homes to test that was lifted several weeks ago, probably about a good month ago now, and those that are funded by Medicaid, Medicare under CMS guidelines, they are still required to test according to our positivity rate in the community. So if we're over 5%, they have to test more frequently, which is what they're doing currently. But there are those facilities that are not under the CMS regulations, and they have reached out to the county as well as the health department for assistance in testing. So I am proud to say the county has been extremely supportive in those facilities, making sure that they have adequate resources to test, according to the guidelines and appropriately. We also, from the health department, send in teams of our healthcare-acquired infection epidemiologist to assess for infection control practices, to do some training, and that we have done that from the beginning, and we will continue to do that to protect that vulnerable population. In our schools, we communicate daily with our schools, and we are seeing a little bit of an increase in cases in our schools. 282 cases have been reported so far, mostly in students, 209 students, 76 staff, and 1 visitor over the course of this response. We have seen, although the majority of these cases are community acquired, we have seen minimal evidence of transmission within settings, school settings, and we're working very closely with the schools to make sure that we are able to minimize that as much as possible. Just as with our other congregate setting, the long-term care facilities and nursing homes that we spoke of. Also in any of our jails or correctional facilities, juvenile detention, anywhere where we're seeing congregate settings, there is a potential for increase in cases. So we remain vigilant with that as well. So far in Seminole County, we've had a total of 909 cases reported in pediatrics, or children. And of those, the majority of them are in 15 to 24-year-olds, 2,222 cases to be exact, with 16 hospitalizations within that age group. And so that is our university college age as well as high school age. And so we're working very closely with our neighbors, other county officials surrounding Seminole County to make sure that those messages get out and the mitigation to prevent the spread of the virus as well. Just want to touch real quick on, I know I've mentioned it before, but the percentage of deaths that are occurring in our county, the majority are in those age 75 to 84 years of age. That's 73% of reported deaths in our county. The next is 65 to 74-year-olds, the next highest, and that's 16% of our deaths reported are in that age group. The others, 35 to 64 years of age, make up 11% of the deaths reported in Seminole County. We are fortunate that we have not had any deaths to date in those under age 35 years of age in our community. So hence the importance of our continued vigilance. I want to talk a little bit about the vaccine. As many of you heard, the announcement yesterday from Pfizer is very encouraging, but preliminary data, certainly indicates that the vaccine candidate it seems to be more than 90% effective in preventing COVID-19. That's really high, like I said, encouraging, but there's more studies that need to be done before we're even at the point of vaccine distribution. And there are several measures in place that assures the safety and efficacy of any vaccine that's manufactured, whether it be for COVID or anything else. And so there's an advisory committee on immunization practices that once a vaccine is approved by the emergency use authorization, FDA emergency use authorization, those recommendations will come forth to make sure that we ensure safety and when we administer to our community. And so there are also such things from the government as vaccine adverse event reports and other reporting systems in the event that even after a vaccine comes forward, we assure that if there are any side effects, that those get reported timely, and we make sure that those are minimal. If not, then certainly the researchers and scientists will revisit. As far as when vaccine will be available to our community, that's everybody's been asking, and certainly that will assist in keeping the spread of this virus from occurring. The priority groups that have been identified, as far as we know to date, with the information that we're receiving from Health and Human Services, is the hospitals, the healthcare workers and other essential workers, and those that I mentioned in those vulnerable populations in our long-term care facilities, nursing homes, and ALFs. So those would be the populations that the vaccine will be available first. As far as the general public, it appears that vaccine may not be available to the general public until after the first quarter next year. So you're looking at March, April timeframe. And that really has to do with the extreme volume of vaccines that need to be produced nationwide, globally, actually, not just nationwide. And so if you want to see the vaccine plan from the Florida Department of Health is posted on the Florida Health COVID-19.gov website. And so that plan was distributed from the HHS plan, or Health and Human Services plan, subsequent to that being released. The county and the health department, as well as many of our other partners, have worked very closely over the last several weeks to prepare for the receipt of the vaccine. And I'll let Alan Harris speak a little bit more to that, as far as what we are doing collectively to make sure that we are prepared to administer the vaccine as soon as we receive it to our high-risk population as well as the general public. Just want to leave you with a reminder as holiday season comes about. I know that many of us want to get together with family and friends. We're not saying you can't, but just take precautions. Limit the number of people who meet in one location. There's guidance out there from the Centers for Disease Control and Prevention that just came out yesterday, as well as some information on the health department's website, seminole.floridahealth.gov. Just some gentle reminders on what you can do to protect your loved ones as you come together for the holidays. So with that, I'll turn it over to Alan Harris, our County Emergency Manager.
All right, thank you, Donna, and thank you, Chairman. This is day 243 in the Emergency Operations Center here at Seminole County, and we're continuing to monitor, of course, the cases of COVID. And our basic stance today, of course, is the numbers are going up here in Seminole County. It does have us concerned. It is not going up at the level it was going at the last spike, but it is going up enough that has us concerned. And that's why we wanted to do the press conference today. We know that because of some of the actions that people have taken, most of the people in Seminole County have taken, that is the reason that we're not seeing the spike as exponential as it was the last time. And we hope people will continue to do the right thing to protect their friends, their family members, their coworkers. We are doing what we've done since day one. We are continuing to support the assisted living facilities and nursing homes. We're continuing to support individuals that are isolated and quarantined in their homes. Individuals that some right now may have economic challenges, so they can't get food delivered to them. We're supporting those individuals because they can't leave, they can't go to the grocery store, they can't because they're sick inside of their homes. We call those individuals every day. The numbers of active cases here in Seminole County just 3 weeks ago was just in the mid 300s, now over 700 cases in the county active individuals with COVID-19. Individuals isolated and quarantined in the home was down. That includes the persons that have come in contact with COVID down to the 500s just about 3 to 4 weeks ago, and now we're flirting with 1,000. We're near 900, or mid 900s. So obviously that puts a strain on our community. So I want to thank again, and the chairman already has, but I want to thank our nonprofit organizations that have provided us those food products that we can provide to the individuals that are isolated and quarantined in their homes. While we're responding to the incident, of course, we're preparing for the future, and we're preparing for the future by making sure that we are ready once the vaccine starts to get distributed to our community, that we can distribute that to the individuals that need it. The healthcare workers, those people in assisted living facilities and nursing homes. So we've purchased items to help with that, where we may have open points of dispersing, where we'll be giving out pharmaceuticals to individuals, vaccines to individuals in an open environment where the public can come. And then closed points of dispensing where We're giving those out to targeted groups, like our assisted living facilities and nursing homes, healthcare workers, first responders, law enforcement officers, firefighters, individuals as such. We aren't going to stop. We are going to continue our operation, and we know that it's taxing. And we hope that people will take heed as it goes into the holiday season, but we also understand that people need the spiritual and mental support of the family members during this crisis. So we hope that everyone has a very, very safe holiday season. Well, I'm sure we'll be talking prior to that. But I want to talk about another holiday, and of course that's the holiday tomorrow, and that's Veterans Day, and we want to thank all those that have served our country so valiantly. Tomorrow we will have our offices closed, our libraries will be closed, our main offices will be closed in honor of Veterans Day, and we honor everybody that has served our country. I want to thank those in Seminole County that have served our country, as well as specifically some of the employees that are going to continue to serve even tomorrow. Some of the first responders that have served our country, but they're also working tomorrow in those first response activities. On another front, we must talk, it's unfortunate, but we must talk about the hurricane season. And that is that very happy that Tropical Storm Eta did not turn into a hurricane as forecasted and is not moving in our direction. In fact, it looks like it will dissipate and move into the Panhandle, probably as a tropical depression or maybe just a storm. But it does remind us that we are still in hurricane season and we still need to be prepared for hurricanes to come, so please closely monitor weather. We were very blessed that Tropical Storm Eta did not come our direction. The forecast was that we were supposed to get a little bit more rain than we did, and thankfully we did not. So the St. Johns River is now not forecasted to go into action stage again, which was good. It was in action stage just a month ago, and we had to close multiple parks and multiple boat ramps and multiple other locations. Two locations continue to remain closed. Lake Jessup Wilderness area, it's just, the ground is just too saturated. We can't get emergency vehicles in there. If someone gets trapped out there, it's just not safe, so that remains closed. As well as the Geneva Wilderness area, there are two sections of that are closed off because it's just not safe to be in those areas. With that, I'm going to turn it back over to the chairman, but again, I just want to thank all those that have served our country so well. Thank you, and I hope everybody has a safe Veterans Day. Chairman?
Thank you, Alan. Thank you, Donna. So as everybody has heard, once again, we are doing great strides for the community on the nonprofit side, as well as our emergency management people who are looking to the future when this virus or when this vaccine is fully available to go to the public. Seminole County at this juncture stands ready to receive and begin administering that vaccine. And by doing that and securing those very critical storage items and apparatuses is going to go a long way as this becomes, again, much like the ventilators, everybody's going to be fighting for that technology to gain that storage capacity. So here in Seminole, we've already hit that stride running and secured that. So with that said, thank you, Donna. Thank you, Alan. I appreciate everybody being here today. Any questions that you may have, we'll ask those folks to come up to the podium.
I got a question.
Yes.
When we're talking about the freezers and stuff, we did a story with you a couple months ago. Do you guys have those freezers, those ultra-cold freezers in-house now?
We do. Yes, so the question is related to the ultra-cold freezers, negative 80 degrees Celsius freezers. You have to have special equipment just to even open it. Yes, we do. We have those. We went ahead and purchased those. There are a couple secure sites around the community. We didn't put them all in one location just for security's sake, but they are in multiple locations around the community. Florida Department of Health has 3 of them. We have one of them here in Seminole County at a government site. That's again for those closed pods. The first responders giving vaccine to other first responders, which is part of the overall comprehensive plan for delivering the vaccine to the community. Other commodities have been purchased, like light towers if we do vaccines at night, tenting, those types of things if we do drive-through. So it just depends on the vaccine. There are so many different vaccines that are being tested right now. We have to find out which one is going to be approved, and then what are the requirements for that? Can we even do a drive-through? I don't know until I know the vaccine. So we'll figure that out as these start to come online.
Alan, did I hear you also have like trailer or if not more than one, but at least a trailer where you can take the vaccine remotely to people?
Correct. So we purchased also a vaccine trailer that'll go into some low-income communities, lesser served maybe communities, and people with transportation disadvantage, things like that, to help those individuals get the vaccines that they need.
How important is it to have these freezers and the trailer already purchased? Because you know when it comes to be March and April, the whole world's going to want those.
Yeah, the question is related to how important it is to go ahead and plan and start to procure some of these items. We thought that was very, very important, so we went ahead and started planning months ago, just like we planned months before we even had our first COVID case. We had gone through an exercise. We've actually, we went through the planning process. We already did one exercise. The exercise was a flu vaccine, but we pretended that it was COVID. We had evaluators there to go through that. We identified some logistical needs we would have once the vaccine. That includes anything from a push cart to put vaccines on it, to tenting, to lights, to the trailer, all of those things. And then we started to procure those things. And then also just look around the county. Do we have those? Can we secure those from locations? So we did a gap analysis to identify what we needed.
And so what's missing now? Is there anything missing from your plan that you've gone through this sort of mock training and you said, oh, we need this? Is there anything missing?
So we have 471,000 individuals in Seminole County. And we only have a certain amount of nurses, and we only have a certain amount of firefighters. So we're looking now at some staffing, some partnerships with some nonprofit medical facilities, which we've already partnered with. We've been partnering with them since day one for the community testing, Allied Health, True Health, Shepherd's Hope, those types of organizations that can help us when the vaccine is ready to go to the entire community at large. There are other smaller items, and we're in the process of procuring those items as we see a need.
And have you guys been in contact with the people in charge of this Operation Warp Speed as far as how many vaccines this county will get in particular, or is that something that's handled at the state level?
That question is the question I think that we all want the answer to, and that is how many vaccines are coming and when will they be here? And I don't think anyone's ready to give that answer at this point. I can tell you Donna asked on every one of her calls, and I ask on every one of my calls, where is it going to be? What is it going to be? We don't even know what it's going to be. It could be Pfizer. Pfizer made the answer, but it could be Gilead. It could be multitudes of other types of Operation Warp Speed simply just means that multiple companies are doing vaccine test trials at the exact same time. While they're doing the test trials, they're also producing the vaccine. So once it gets approved, then that vaccine will be ready. So we don't know which vaccine will be sent to us. If multiple companies receive the approval, which one are we getting? Are we getting the Pfizer one, or are we getting another one? We don't know.
You feel like you've got the equipment and some of the early training in place, so as they arrive, you can distribute them almost with quick turnaround.
That's exactly what we wanted to do. We wanted to be ready no matter what. We know certain things, right? We know we want to go into the transportation disadvantaged communities. We know we will need shelter when we get there. We know that there's going to be a large number of individuals that will need vaccination. So we purchased items because of that.
A question for
Yes.
so we know the numbers are going up. What are the contact tracers hearing as far as where the people are saying they're getting this from? Is it restaurants? Is it cars? Is it going shopping? Where are they saying that they're getting these from?
Well, people are out and about, so it's been very challenging to determine the source of the infection. When we do have evidence of some clusters, outbreaks, if you will, of multiple people potentially exposed to the same source, but we can't say definitively where somebody got the virus, honestly, because there are asymptomatic folks, there are symptomatic folks. So it's been very difficult to determine. I will tell you that we don't have evidence of any particular business or restaurant or, that you hear perhaps in other counties that they're able to say, well, it's most likely they all got it from this one place, because people are exposed in multiple places throughout the day.
But not to read too much into that, it sounds like, almost like you're saying that it's more like private gatherings, backyard, family.
If you can look at the incubation period and when people develop symptoms and where and when they were exposed during that period of time that they could have contracted the virus, then yes, those gatherings are more likely to cause an outbreak or cluster of cases than just random exposures throughout the day. But it is more challenging as people are getting out more. It's more challenging. We continue, though, to do our case investigations and our contact tracing and advise those folks who may have been exposed to please stay at home for 14 days because that as well will keep it from spreading. But to answer your question, it's been very difficult to determine individually where people contract the virus.
Is there any worry about hospital beds? I was looking on,
Yeah.
they have, I think the county here, less than about 4% of beds available in the ICU. Is there any concern right now?
We have not heard any concern. We have our weekly calls with the hospital partners. During the peak of the event, they even converted some of their other wings to ICU wings. So the hospitals are equipped and prepared to do that in the event they need to, but we have not heard a concern from any of our hospital systems so far.
I want to thank everybody from the media again for being here to help us get out the message. I just want to, again, thank the community and the business folks for doing what we know is right. I know a lot of us want a certainty. We want to know when this is all going to be over. Everybody wants an answer. When can we stop doing this? There's a lot of smart people working on this around the world. And believe me, if there was an answer to when this would all end, a date certain, I think we would all agree we would have that by now. Until then, we got to be smart and do what we know and use the tools we have, which is the social distancing, wash your hands, wear a mask. It's a small price to pay to be able to get out and interact with the public and get out and do business, and our businesses stay, in business. So, again, thank you all very much. We're going to have Freddie Gonzalez is going to come up and do our Spanish translation. I thank him very much for that. I ask that everybody be safe and be well.
Buenas tardes, este va a ser el resumen en español para la conferencia de prensa del 10 de noviembre del 2020. Empezó hablando el presidente de la Junta de Comisionados del Condado, Jason Bauer, mencionando que este viernes, el 13 de noviembre, se cerrará el portal de solicitud de subvenciones para pequeñas empresas del Seminole CARES. Hasta la fecha, las fases 1 y 2 del programa CARES ha dado fondos por casi 11.5 millones de dólares para más de 1.500 pequeñas empresas del condado de Seminole. Esos comerciales recibirán un promedio de $7,000. Además, el condado ha aprobado más de 4.200 solicitantes de asistencia individual por casi 17 millones entre la fase 1 y la fase 2. Las personas aprobadas recibieron un promedio de casi $4,000 por hogar. Originalmente, el condado asignó $10 millones para pequeñas empresas y $7 millones para asistencia individual. Sin embargo, al haber una mayor necesidad, ha aprobado más fondos adicionales para el programa. Y los fondos para asistencia financiera serían 14 millones para empresas y 19 millones para personas. Además, ha dado $2.9 millones a 44 organizaciones sin fines de lucro que han ayudado mucho a la comunidad del condado de Seminole. También mencionó que el condado de Seminole, a promedio de más de $31 millones al año, recibieron en subvenciones federales y estatales durante los últimos 3 años. El condado recibió casi 43 millones en subvenciones durante el año 2019. Según la oficial de presupuesto, la mayoría de estas subvenciones están involucradas en datos del censo. El condado de Seminole sigue siendo el número 1 entre los condados de la Florida en cuanto a respuesta de residentes para el censo del año 2020 y la tasa de un 73.6%. Y el promedio nacional es un 67%. Él finalmente mencionó que la orden de uso de mascarilla y distanciamiento social del condado de Seminole sigue vigente a pesar de los rumores. Cuando se encuentra en lugar de reunión, negocios o otros lugares abiertos, el público en el condado de Seminole, las personas deben mantener un distanciamiento social y los miembros mismos que viven en el mismo hogar no tienen que usar mascarilla, pero los que no viven en el mismo hogar y no pueden estar más de 6 pies de distanciamiento, deben estar usando mascarilla todo el tiempo. Dentro de las empresas privadas, si un cliente no cumple, la empresa puede rechazar el servicio o ponerse en contacto con la policía. Si requieren máscaras para todos los clientes y empleados en las instalaciones del condado, si un visitante no tiene una máscara, les dará uno en la entrada. Como recuerdo, el condado de Seminole y las 7 ciudades no han dado multas hasta este momento. Nuestra meta es tener la comunidad que esté ayudando a controlar este virus y a la misma vez manteniendo la economía marchando. Después vino la directora del Departamento de Salud, Donna Walsh, mencionando que en este día hay 847,000 casos en el estado de la Florida y a la misma vez 17,000 muertos que ha pasado. En el condado de Seminole hay 11,000 casos positivos y 253 muertos. Ella mencionó que en el total de que empezó esto hay 771 personas que fueron hospitalizados y 56 activos en este momento. Mencionó que el Departamento de Salud está constantemente cada semana teniendo reuniones con los hospitales y las casas de salud, ayudándolos en todo lo que puedan y averiguando en qué lugares pueden ayudar y mejorar para bajar este virus. En ese momento hay una tasa de positividad a un 9.57%, que las últimas vez que teníamos una conferencia de prensa, el número estaba a 3 y pico %. También mencionó que de los muertos, 162 muertos vienen de las casas de salud, que es un 63%, que mencionó que están tratando lo mejor que puedan en mejorar esos números y bajar o que no suban las muertes en un paso que está subiendo. También está trabajando con las escuelas que vieron que había 282 casos en las escuelas públicas de que comienzo de este año. Mencionó también que había un anuncio ayer que puede haber una vacuna pronto, que todavía no es oficial y tiene que hacer más pruebas y pasar por un proceso más largo, pero hay un buen chance que salga una vacuna pronto. Pero el problema es, tiene que hacer un plan y prepararse para ver si sale esa vacuna, cómo puede el Departamento de Salud y el condado esté preparado para dar esa vacuna. También mencionó que ya pronto viene el tiempo de las fiestas y hay que tener mucha sabiduría en cómo vamos a celebrar, a tener mucho cuidado en las reuniones grandes, que sabemos que siempre queremos pasar tiempo con familia y amistades, pero hay que tener mucho cuidado en las semanas que vienen. Finalmente, el director de manejo de emergencia del condado, Alan Harris, mencionó que la oficina de emergencia está trabajando ya 243 días en el tema del virus. Vemos que los casos hay un aumento, no como el verano, que había un aumento más que ahora, pero sí el aumento. Pero la buena cosa es el aumento no es va un paso menos que el verano porque la gente sigue haciendo lo que deben de hacer usando mascarilla, teniendo distanciamiento social y lavándose las manos frecuentemente. A la misma vez ve también que hace 3 semanas había más o menos 300 y pico de personas con el virus y ahora vemos que hay como 700 personas de promedio. También mencionó que se está preparando para que cuando confirmen una vacuna en un futuro, que esté preparado para dar un plan de ayudar a las casas de salud y hospitales y cualquier otra persona que está en necesidad más importante. Y también está preparándose por una tormenta tropical que está en la área. Vemos la buena noticia es que no va a estar de camino a nosotros, pero que parece que va a estar extiéndose en otro lugar. Pero es un recordatorio que todavía estamos en la temporada de huracanes y hay que siempre estar preparado para cualquier cosa. Él finalmente mencionó que mañana el condado va a estar cerrado por dar el día de agradecimiento a los soldados que han peleado por nosotros. Finalmente, si tienen cualquier otra pregunta o necesitan cualquier otra información, pueden visitar nuestra página de web que es prepareseminole.org y a la misma vez pueden llamar nuestro número a 407-665-0000. Muchas gracias.